Hey everyone, my name is Dr. Deric Peterson and I'm an audiologist here at Amdahl Hearing in St. Cloud. Today I just wanted to spend a few minutes talking with you about what to expect during your hearing test appointment. When we sit down with patients and their families to go through the process of trying to determine how to help them hear better, one of the things that we take pride in doing is spending time with people to be able to listen to not only the patient's story in their journey of better hearing, but also with their loved ones and how it impacts them in their everyday life. So what we do is we typically schedule anywhere from an hour or more if needed to be able to spend some time to interview both the patient and their family in their everyday life, where situations they're noticing some of the most difficulty is taking place. In addition to that, we want to make sure as a medical professional that we also spend the time to appreciate some of the complex medical histories, as well as being able to determine if there's any concerns that would warrant other medical referrals that would take priority over any hearing loss treatments. After we spend time to really appreciate in each patient's everyday life what difficulties they're having, then we spend about 15 to 20 minutes doing a thorough examination, which involves ruling out if there's any earwax, being able to determine which tones patients are able to hear and at what level, so that we can get an idea of their prescription, as well as how they perform with understanding speech in both quiet and noisy environments. Once we've completed the examination portion, then we spend a lot of time thoroughly educating the patient and their families on what results we've found, and then how that relates back to what some of the goals are that they had when they originally came in. A lot of what we do is not to tell people what they want to hear when they come in, but to give them the honest assessments that they need to hear, in which we can provide them either treatments to help fix their problem completely, or be able to just manage it and be upfront and honest with them about what to expect. We do offer demonstrations with devices in office when applicable, so that patients can have the ability to experience better hearing even in our controlled environment, as well as we do have 2-week demo trials that are available for patients as well who might be not quite ready to take the step to pursuing hearing aids at that time, just so that they have the ability to kind of have an idea of what it's like without committing both financially as well as time. So that's just an idea of how we kind of go about our process of spending time with patients to determine not only what their problems are, but how to fix it. But then really just our premise is educators, just to allow them to have an idea of what sort of things that we can do to help enhance their quality of life. So if you or a loved one is experiencing any difficulties with hearing or understanding in different environments, or if you just haven't had a test done since high school, please feel free to give us a call and get that scheduled. Thanks.